So welcome to the OSCE course preview. This OSCE course preview is particularly for those who are interested in writing the exam in 2026, whether they decide to do the February exam, the May exam, or even the November exam. So today's course preview, we're going to go through essentially what SolRx has to offer. We will demonstrate a sample case as well for those of you who haven't started studying OSCEs yet or want to start studying OSCEs, so you have a general idea of what a case would look like and how it's expected to be performed. Then we will go through what SolRx has to offer for these courses or for this particular course. And then we will open up the floor to any Q&As you may have. Now, people may join while we are doing the presentation, which is absolutely fine. But just to remind everyone, please keep yourselves muted and your videos off so we can be respectful to the presentation. So first off, today's agenda is going to be a brief introduction of the SolRx team, who are responsible for the OSCE course. We're going to talk about the OSCE exam in case you're not too sure what the details look like or what the OSCE exam entails. Then we will talk about our course, some common mistakes you want to avoid while studying for OSCEs or doing OSCE cases, some tips for success based on our experiences teaching OSCEs for many, many years. Then we will wrap up with the sample case performance and closing statements. So before we begin, we do want to introduce ourselves very quickly. Generally speaking, our team is quite large, but today we have myself as well as Hye-Yeong here. So a little bit of a breakdown or brief history of myself. My name is Parmeet. If you guys know me, that's great. If you don't, I am one of the directors for SolRx, and I've been part of SolRx for many, many years. I originally started off my journey as one of the OSCE instructors, and then we expanded our offerings to the MCQ course, as well as our recent partnership with the Canadian Red Cross. In terms of my other experience, I was a pharmacy manager at Shoppers Drug Mart for quite a few years. And currently, I still do work at Shoppers Drug Mart, more so as a consultant for any kind of incidents that do occur in the pharmacy. I pretty much go in and investigate to see what's going on. Besides that, I do have extensive hospital experience working at Sick Kids Hospital in downtown Toronto, where I did a little bit of a clinical research for pediatric oncology medication. Nowadays, primarily, I am a OSCE instructor as well as MCQ instructor. We do have our founder, his name is Vipul Shah, and our other director, Arav Shah. They're not in this meeting today, but again, they have extensive background when it comes to owning many pharmacies and managing many pharmacies. Before I hand it over to Hye-Yeong, I'll also introduce our other instructors that you will encounter in our OSCE course should you decide to enroll. We have Mohanand, Tumama, Ella, as well as Ala, and all four of these individuals have extensive background in community pharmacy, and their pharmacy backgrounds from back home are quite vast as well. I'll hand it over to Hye-Yeong to briefly explain her background, and then we can go ahead and get started.
Hi everyone, my name is Hye-Yeong. I'm one of the main instructors for OSCE and also MCQ calculation instructor. And good to meet you all. I am an international pharmacy graduate. I got my PharmD back home. I moved to Canada not knowing anything about Canadian pharmacy. And went through the licensing journey just like almost all of you guys are going through, And me and SolRx, we started when I first registered as a student. So thanks to SolRx OSCE course, I was able to pass OSCE with my first attempt. And ever since then, I've been working with SolRx for a few years, creating course content and as an instructor as well. My experience as a community pharmacist, I'm currently licensed community pharmacist in Ontario, and I was working as a pharmacy manager in one of the big retail pharmacies. And now currently I'm working full-time with SolRx. Now I'll hand it back to Parmeet.
Thank you, Hye-Yeong. So one thing we do pride ourselves in is the experience that our instructors do have. And we're grateful to say that a lot of our instructors are full-time staff with SolRx. So we do have a lot to offer, but we will kind of discuss that today as well. So we're going to go ahead and start talking about the OSCE exam, because of course, many of you may be studying for the OSCE exam and you may not know too much about it, or you're not too sure where to start. But the best way to start is actually understanding the exam itself. When it comes to the OSCE exam, the purpose is to pretty much assess your communication, your problem solving, your clinical judgment, and your professionalism. Yes, it is a clinical exam, but a lot of the clinical aspects are tested in MCQ. OSCE is more so to test how can you speak to an individual and solve their problem? How good are your communication skills? How quickly can you think on the spot in a timed setting to ensure you provide the appropriate care to the patient? For those of you who may have worked in pharmacy in Canada, you might notice that you see many, many patients every single day. So time is very sensitive when you're speaking to patients. OSCE stations are timed as well. You have 7 minutes to complete each station. I'm going to break down what these time entails, but before I do, just a little brief structure of what the OSCE exam looks like. It is in total 11 stations, meaning you have a split of interactive and non-interactive stations. You have 7 minutes to complete each station, and between each station, you have 2 minutes to move to the following station and read the door note. I'm going to explain more about this in a moment. The interactive and non-interactive stations, you tend to have 9 interactive stations and 2 non-interactive stations. Now, what do I mean by this? An interactive station is basically when you enter the room, you have an individual waiting for you, which is usually the assessor, and they're going to sit there silently and just mark your performance. Besides that, you will have another actor, and the actor will act as either the patient, a caregiver, a doctor, or another healthcare provider. And their job is to pretty much role play a scenario with you within 7 minutes, and the assessor will be there giving you a mark on how well you're performing. And there's a lot of things the assessor looks out for. We are going to break down the assessment sheet later on today as well when we show a sample case, but there's particularly 3 things: outcome, performance, and communication. And we will discuss that more in detail later on. Besides interactive stations, you have non-interactive stations. As the name entails, when you enter the room, you're in a non-interactive setting, meaning that there is no one else inside the room. It is just you and potentially a answer sheet, which you have to fill out. Now, that non-interactive station could be anything such as dispense checking. So you're checking products and comparing them to the prescription to make sure they're filled correctly. Or it could be prescription screening, where you're going through a variety of prescriptions. Clinically and legally, you go through them to see if there's any mistakes that the doctor or prescriber may have made on those prescriptions. Sometimes you might even get Q&A stations, so question and answer, similar to what you're used to in MCQ, where you have a reference and you have a bunch of questions that you do have to answer. Generally speaking, more students are worried about interactive stations rather than non-interactive, but based on our experience, both are equally important. Interactive stations sound more difficult because you're physically interacting with another individual. Non-interactive stations are something we're more familiar with. It's like writing a test back in school. But like I said, we have 7 minutes between the stations, or during the station, sorry, and 2 minutes between. How you use this time in the exam is very, very important. When you enter a station, before you go inside, you have 2 minutes to read a door note. We're going to show you an example of a door note later today, but a door note pretty much tells you what you can expect inside the room. Sometimes the door note may be very simple, or sometimes it gives extra information which you can utilize. An example could be a patient is waiting inside the room for an over-the-counter recommendation. The second you see this door note, your head starts to go places. Ideally, you want to start thinking about over-the-counter cases. How should you perform during an over-the-counter recommendation case? And SolRx has actually developed many acronyms and a format, a guide to utilize for every different type of station. Usually we expect about 9 different types of stations. It could be a healthcare provider case. It could be a counseling case, an over-the-counter recommendation case. It could be a doctor case. It could be professional judgment, dispensing error, and the list goes on. But we have developed guides for all these types of stations. So when you read the door note, you're able to understand what might be on the inside of the room, so you can write your notes down accordingly. And yes, you might be wondering, what notes am I talking about? You are given a notepad as well as a pencil. And you are allowed to walk with this notepad and pencil as well as an eraser throughout the exam and write down notes that you find are appropriate for the stations. Now, after your 2 minutes are up, so this section right over here, you're going to hear a bell that indicates that the station has started. So once you hear that bell, you pretty much open the door and you enter the room. Once you enter the room, your 7 minutes have begun. Now, in most cases, When you enter the room, the only person there will be the assessor. The actor may not be inside the room. The actor is known as an SP, also known as standardized patient. Usually these individuals enter after 20 seconds. What do you do during these 20 seconds is very important. And in SolRx, we tell you literally what you are supposed to do in every second of the case. So these 20 seconds are very essential. Essentially, you are looking at your table, you're seeing what you have, and you're orienting yourself to the case before the SP enters the room. Once they enter the room, you're pretty much in charge of the case. You are in control. You will go ahead and start speaking and try to figure out whatever problem the SP has, and you try to solve it. Of course, in some stations, you are given a reference or some tools. These references are pretty much what you are going to utilize to ensure you can give the correct answer within that 7 minutes. At the 5th minute mark, you hear another bell, which is our warning bell, telling you that you have 2 minutes remaining in this case. Now, usually at this time, we always recommend students start wrapping up their case, explaining whatever needs to be said to get all the points they can get. OSCEs is all about strategy. If you walk in with no strategy, it will be a very difficult exam. But if you go in being strategic and you get the points that you need, most probably you will pass the exam. Now, at the final point, at the 7 minute mark, you will hear another bell indicating that the station is now over. So at this time, students would get up and move to the next station, and you will rinse and repeat until all stations are over. That would mean 7 stations in total. However, on the exam, since there are many students in one circuit, you tend to have many rest stations. A rest station is pretty much where you go, you sit down for about 7 minutes, and you wait until the next station starts. These rest stations are there literally for rest because there are many students on the circuit. So this way they're able to accommodate more than just 11 students. Now that was just a brief little overview. Of course, we go down in much more detail when it comes to utilizing your time effectively. This is all time management. I did mention there's many different types of stations. So we've already kind of reviewed this, but here you can see on the screen the different types of stations you can get for each type or each category. For interactives, you might be speaking to a patient, agent, or healthcare provider. You might have to do counseling, therapeutic recommendation, or clarifications for prescriptions. The assessor always observes you. They never interact with you. So if you ask them a question, most probably they're not going to say anything. Their job is pretty much to sit there and assess you and make sure they are able to give you the grade. And then later on, they use that grade to determine whether you pass or fail the exam. So I'm just going to remind everyone, please mute yourselves. That being said, in non-interactive stations, you might have written responses, you might have fill in the blank or fill in the bubbles, which is like MCQ, and you might have to answer some questions in a time setting. There is a buzzer that the exam uses. Each station is responsible, or each exam center is responsible for demonstrating that buzzer before the exam begins. So you're able to follow along and take the course or take the exam accordingly. Now, before we move on, I will give you guys an opportunity to ask any questions in between our segments. So does anyone have any questions about the timing of stations or the type of stations you can expect before we talk about common mistakes you would want to avoid? So you can utilize the chat. Please feel free to ask any questions in the chat, and one of us will make sure to answer them, even if we're already speaking about a topic. So for now, I'm going to ask Hye-Yeong. You can talk about the.
Thank you, Parmeet. So we'll go ahead and discuss some common mistakes to avoid. These are mistakes that often happens, and we, through our experience, learn that these are very important points that you should always remember from now on until the moment that you exit the exam room. So first, memorizing cases instead of learning the structure. Do not memorize any full cases. PBC is known and famous for bringing in a case that they might have used before, but they changed something. You'll soon know when you see the demonstration of the case that answer to one question, because you have so many information gathering questions that you need to ask the patient, answer to one single question can completely change your answer. So understanding the case is a lot more important rather than memorizing the case. So our focus should be understand the flow, get the communication technique and demonstrate the communication technique and build good, solid clinical reasoning. Second mistake, ignoring time management. Now you may think that 7 minutes sound good enough time. However, you will soon realize that there are lots of things that we need to inquire to make sure that we are making safe and appropriate decision for the patient. Therefore, managing the time is very important. Skipping non-interactive practice. So Parmeet just mentioned that there are two different types of stations, right? 9 interactives and 2 non-interactives. Oftentimes, students overlook those non-interactive practice. However, that shouldn't be the case because our non-interactive station should be the station that we walk in feeling comfortable and confident, then we will get full mark from that station. So you must practice them regularly. Now, fourth mistake, weak acronym usage. So we do have a variety of acronyms that is tailor-made to each different type of cases that you can use them consistently and accordingly. What PEBC expects from pharmacists is to have a structured information gathering skill that you're capable of gathering all the information in an orderly manner. However, they also do not want pharmacists to be very stuck to acronyms only. So we do train and we encourage and we train everyone to internalize the acronyms. However, know when to be flexible, and we will make you practice that to make sure that you meet the expectation of PEBC. Fifth mistake, underestimating the role play practice. So your EE and MCQ, your study groups were more so of an optional. Not everyone had to have a study group to pass the exam. But for OSCE, it's a must. Studying by yourself will not make you pass the exam. Practice out loud and simulating live station with peers as much as possible will be an important key to passing the exam. Now, last mistake, delaying studying and practicing. Waiting will delay your progress and reduce time for reinforcement. The analogy that I love to use all the time for OSCE is OSCE exam is like building your muscle. If I ask all of you that within 2 weeks, you must win a bodybuilding competition by building a great amount of nice muscles, you will all know that probably it's not doable because you need daily practice or daily going to the gym daily to build your muscle to get to that point. And it's not something that you can just get it overnight. And that is exactly same to OSCE. OSCE requires a lot of skills to be internalized, and you should be comfortable applying them. And that doesn't come overnight. So then what are the tips? How should we avoid this? And what are the tips to pass this exam then? Next slide, please, for me. Thank you. So the tips for success. First, focus on the structure, not script. Understand how to approach each different case type using acronyms that will provide and communication flow. You will adapt using the knowledge that you gained throughout practicing different cases, but you are not memorizing it, applying them blindly. Second, practice always with a timer. Make sure that you are capable of performing under pressure of 7 minutes. Third, role play regularly. Must practice with peers often as possible. Start with the scripts. We provide scripts for every single type of case so that you can get used to common sentences that you can adapt and use. Then you should gradually shift to unscripted delivery of your performance to build confidence. Fourth tip will be mastering acronyms early. They guide your thinking, they guide your structured information gathering, and make your answers consistent and complete. Fifth, feedback to improve. So in the class, we give verbal and written format of feedback every single class you'll be getting according to your performance. And also when you're doing role play, you and your peer should give as much detailed review to each other's performance and take that advice and apply to your performance to grow even more. Last tip will be staying consistent. You have to build a regular study routine. Short daily sessions are way more effective than just cramming for the exam. Now we will go into a sample case and I'll hand it back to Parmeet to explain the door note.
Awesome. Thank you, Haeyoung. So when it comes to studying cases and performing cases, like I said before, one of the most important tools you have before a station begins is a door note. A door note essentially is a kind of a brief overview or summary, or even call it a hint as to what you can expect inside the room. And how you understand the door note and break it down is very important for your success. So for example, we will do a case with everyone present, and Hye-Yeong will be the pharmacist and I will be the patient. And here we can read the door note. So let's break it down because this is exactly what a PEBC door note will look like during the actual exam. So here it says candidate instructions. A patient is coming to purchase his regular supply. You haven't seen him buying the same supplies every couple of weeks. He buys only over the counter from your pharmacy and gets prescription medications from another pharmacy. And then references are mentioned at the bottom. You get a product monograph inside the room, and there will be some syringes on the table. So a couple of things we have to break down from the store note. We know that it is a patient that regularly comes to the pharmacy and buys these supplies. From the references on the table, you can assume that these supplies might be syringes. So you can start thinking about what possible cases could you get for syringes. It states that he also buys over-the-counter pharmacies, over-the-counter products from your pharmacy only, but he gets prescription medications from another pharmacy, meaning there might be some medications the patient is on which we do not have in our pharmacy profile. Most probably, we don't even have a profile because it is a patient that only buys over-the-counter products. So these are things that you want to start thinking about when you're looking at a door note. Now, I know there's some questions on the chat, but we're going to go ahead and demonstrate the case, and then we will answer the questions for the chat after the case is done. So keeping in mind, in the exam, you would have 2 minutes to read this door note, and 2 minutes is quite a long time. During this time, you want to start writing down acronyms and some ideas on your notepad. And these acronyms you definitely will learn in our course. And these acronyms will help you guide through your performance and through a case so you don't miss any important information and you're able to keep yourself organized and flowing well. Because OSCE is an objectively structured clinical exam. Yes, objective means that there is one goal and one goal you have to achieve. Structured means it has to follow a format or a flow. Just getting the right answer is not enough. How you get to the answer is also what counts. So be very mindful of that. So we're going to go ahead and do a live performance. So I will show you guys what we have on the table here. On the table, we have our syringes. Now you'll realize that there's no patient profile and nothing else. There is a reference that you will be provided, and we know this because it says there is a product monograph. And for those of you who are watching, the product monograph is going to be testosterone, and this you will only see once you enter the room and you see it on the table. At this point, your 7 minutes have already started. So now we are going to go ahead and demo this case. So Hae-Yeong, whenever you are ready, you can go ahead and start.
Sure. So the patient will enter the room, and as soon as the patient enters, the pharmacist should start the case by introducing themselves. So I'll start the case from here. Hi, my name is Hae-Yeong. I'm the pharmacist on duty. How can I help you?
Hi, can I get 3 milliliter syringes? I'm in a hurry. Please make it quick.
Oh, I see. I can see that you're in a rush, but to help you, I need to ask a few questions to have a clear picture of why you need the syringe and to make sure that it's safe and appropriate for you. It won't take long. Is that okay?
Sure, go ahead.
Okay, please have a seat. Just to let you know, this is our private counseling area. Whatever we discuss here will be kept private and confidential.
Okay.
So may I get your name and age, please?
Yeah, my name is Mike Stone and I'm 30 years old, but you can call me Mike.
Okay, so Mike, what are you using the syringe for? by
To
any
be honest, I
chance?
use it to inject my medication.
Okay, so what medication are you using?
I'm using something called depot testosterone.
Okay, and may I ask if you have any medical conditions? What are you taking the testosterone for?
I don't have any medical conditions, but I want to use it to build muscles, and I've been using it, and it works wonders.
I see this, the testosterone is a hormone that actually can help build muscles, but that's not really for everyone. Have you by any chance seen a doctor for this?
No, I haven't. My friends use this as well, and it works.
Okay, Mike, so it is good that you are aiming to build a muscle, but this is not the proper way to do it because it's not healthy. And in the long run, it may do you more harm than good. And that's why before using any prescription medication, a doctor needs to assess you to make sure that it's the best therapy for your condition. Does that make sense, Mike?
Yeah, I guess it makes sense. I didn't really know that.
Okay, so if you don't mind me asking, how much testosterone and how often do you use?
I use 1.25 ml once a week.
And how do you inject it?
I inject it into the muscles by myself.
I see. And how long have you been doing this or
It's
using
been
this,
about
I
three
mean?
months.
Okay, any health issues from using it? Maybe any side effects that you noticed?
No, actually, it's working really well. My muscles are definitely getting bigger.
Okay. And earlier you mentioned that your friends are using it as well. Do you or your friends by any chance share needles or have shared
I
needles?
don't, I don't share needles, but I know some of my friends do. I do get tempted when I run low on syringes, though.
Okay, I'm glad that you haven't shared any needles. Mike, how do you dispose the needles after using them?
I usually just toss them into the trash bin.
Okay, I really appreciate your honesty, Mike. I would like to ask a few more questions regarding your health in general and create a profile at our pharmacy. Would that be okay with you?
Yeah, go ahead.
Okay, do you have any allergies?
No, I don't.
Okay, what about any medical conditions?
No,
And apart from this medication, are you taking any other prescription medications?
no, I'm not.
What about any over-the-counter medications such as Tylenol, Advil, herbals, supplements,
No,
and any samples from a doctor?
no.
Okay, so thank you, Mike. And I'll also like to ask about lifestyle as this can impact your health as well. Would that be okay?
Sure, go ahead.
Thank you. And do you drink any caffeinated beverages?
Maybe one cup of coffee a day.
What about alcohol?
One glass of wine on the weekend.
Okay. Do you smoke or use any recreational drugs?
No, I don't.
Good. And do you exercise?
No, I do exercise quite a bit, but not too much.
Okay. And can you describe your diet?
I try to eat healthy.
Okay, that's very good that you eat healthy. Thank you for all the information. I just need a moment to check my reference and I'll be back with you shortly.
Sure, go ahead.
So this time, the pharmacist will take some time to go through the reference, which was testosterone monograph, to make sure that you get all the information from the reference that you want to deliver to the patient. So thank you for your patience, Mike. According to my reference, it is indicated for males who have low levels of testosterone, which is a condition called hypogonadism. And the recommended dose is 200 milligram or 2 milliliters every 2 weeks into the muscle by a healthcare professional only, and with a maximum of 4 milliliters per month. Now, in your case, Mike, you're using more than the maximum dose in a month, and that really concerns me because of the impact it may have on your health. Do you by any chance know what it could do to your health, Mike?
Oh no, that's quite worrisome. What can happen?
So, overdosing this medication for a period of time can cause liver damage, infertility, mental issues such as low mood or hallucinations, and in worst case, even stroke and heart attack. And these are just a few things that may happen to you. And I really don't want you to go through any of them. And also carries the risk of dependence. And dependence comes when you're taking dose higher than recommended. And when you finally want to stop or decide to stop, your body with going through withdrawal. And you may experience symptoms like restlessness, low mood, fatigue, craving, sleep problems, and low sexual drive. And those symptoms may last for even weeks or months.
Oh wow, what do I do about this now? I want to stop. What do you advise?
I'm glad that you want to stop using the medication, but this should be coming from your doctor. So I strongly encourage you to see a doctor as soon as possible to get assessed for your condition, and doctor will guide you in coming off this medication. Now, you earlier mentioned that your friends are sharing the needles. So I'll give you a few needles today, but I want to make it clear that this is not to encourage you to continue using the medication, this is not to encourage your friends to continue using the medication. But I'm really concerned about you and your friends' health, and I do not want any of you to share any needles. So I'll be giving you some needles, and I'll be providing you a sharps container to dispose the needles. As you mentioned that you threw it away in a trash bin, but that can cause accidental injury to others. Is that clear? Would that be okay with you, Mike?
Yes, that's great. I should go book an appointment with my doctor right away.
Okay, I'm so glad, Mike. Now, the most effective way of building muscle is having a very healthy and well-balanced diet along with exercise. So you mentioned that you're working out quite a bit. That's very good. I strongly encourage you to speak to a personal trainer and dietitian to help build a plan that will best suit you and best suit your muscle building goal and general health as well. Okay.
Amazing. Thank you. I appreciate that.
Thank you. So would you mind relaying my message about this medication to your friends as well? I strongly encourage them to go see the doctor to get assessed, or you can even encourage them to come speak to you. I'll be more than happy to talk to your friends.
Sure. Thanks for all the information. I'll definitely do that.
Thank you. And would you mind us giving you a call in a day or two just to check on what the doctors discussed with you?
Yes, that would be great. Thank you.
Thank you. Have a great day then.
Awesome. So thank you, Hye-Yeong. Very well done. So some of you guys might be wondering, okay, that was a lot. How do you even know what to say and when to say? Now, that's definitely a good question that you may have. Now, we are going to break down this case in a bit more detail so you kind of understand what the expectations for PBC are. Now, Hye-Yeong didn't just naturally or randomly say all these things. She did have a workflow that she was working through, and that is pretty much what you learn in SolRx. But just to give you guys a brief overview of what the assessment sheet may look like for any PBC case, as well as all the cases in SolRx, this is an example of that. So here you can see that there are many different marks you can obtain throughout this case. You get a mark for pretty much introducing yourself, collecting information, giving the answer, and even wrapping up the case. And you'll notice that on the right-hand side, we allocated a small amount of time that you should be taking doing these tasks. Now, if you follow this time recommendation, then you're never going to have a problem with time management. But let's break it down even further. So here you can see introducing yourself, asking the reason for visit, getting them seated, and acknowledging that the person's in a hurry and addressing their name, you get 1 point. Then from there becomes your information gathering. How well do you collect information? You have to inquire, not just right away jump into, you're updating the patient profile. You have to ask what brings the patient in. You want to ask about the medication, why they need the syringes, have they been seeing a doctor? What are they using the syringes for? How much are they injecting? How long have they been doing it? Have they noticed any negative or even positive impacts of the medication? And how do they get rid of the dirty needles? All of that is information gathering, which is worth about 3 points. Then comes creating a patient profile and updating it. You'll notice in this case, there was no patient profile in the pharmacy, but Hye-Yeong said something very important. She said, is it okay if I create a profile? Now, if you studied MCQ, or even if you studied OSCEs before, you know that OSCEs and MCQ are all about the NAPRA competencies. One of the competencies is intra-professional collaboration. Intra means within the team. When you update and create a profile, you are getting a point for intra-professional collaboration. So she asked me about my allergies, my medical conditions, any medications I may be on, as well as over-the-counter products. After that, she continued to update the patient's lifestyle information. Now, you might be wondering, why is lifestyle relevant? In some cases, lifestyle definitely does impact the outcome of the case. In this case, I'm trying to build muscle. I'm trying to get a good physique. What is the best way to get good physique? It's exercise and diet, your alcohol consumption, caffeine, smoking, everything is actually related to having good physique. So it's important that Hye-Yeong collect this information so she can utilize it to wrap up the case when she educated me on working out and eating healthy. Then from there, she took a moment and read her reference. Usually we recommend 1 to 2 minutes to read the reference. Why I'm saying that? Because 7 minutes goes by quite quickly. If you don't know how to utilize the reference, then definitely it becomes difficult. References can range anywhere between 10 to 20 pages on the exam, but that does not mean you are going to need every single page. We train you exactly where to look for the answer when it comes to a reference. Upon checking the reference, she came back and she explained what testosterone usually is used for and properly indicated for within Canada. And it is not necessarily to build muscle, it's for other reasons. And she explained that very well. And then from there, you can see that the patient became a little apprehensive, which is according to my script. She explained what are the negative impacts of using this medication incorrectly, also because the patient's been using it at a higher dose. She then made the referral to the doctor for me to get more assessment and education on how I can stop the medication. But at the same time, she also acknowledged that my friends are also using this medication. So she did not stop there. She followed a principle called harm reduction. She offered a few syringes to prevent needle sharing, because at one point during my case, I did mention that my friends sometimes do share needles. I don't, but my friends do. Now she's getting a point for health promotion because she is reducing harm to others associated with the patient. Then she continued to get more points for health promotion by offering a sharps container. A sharps container, why? Because we want to make sure we're not throwing dirty needles into the trash bin. And then she ended off the case with some self-care measures, explaining what is the best way to build muscle, which is through diet and exercise. But she didn't stop there. She also got an interprofessional collaboration point by referring me to a potential dietitian or even a personal trainer. And then you always wrap up your case with follow-up and further education. She offered to share this information with the friends and offered to call me in a couple of days after the doctor's visit to see how the patient did. Now, all in all, that case is worth 15 points. But if you remember, PBC marks you on 3 different categories. They mark you on communication, outcome, and performance. So what is communication, outcome, performance? Performance is your overall mark for the case. This includes the outcome. It also includes your interviewing skills. What questions did you ask? What irrelevant questions did you ask? And how did you overall wrap up the case? So you'll notice that some areas are white and some areas are shaded in. There's a reason for that. But all you need to know is performance is your total score. Out of 15 points, what did you get? You will get a level 4 if you got 12 to 15, a level 3 if you got 9 to 11, 2 or 1 if you got lower. Our goal is always for students to achieve a level 4. Now, you're not going to fail for getting level 3s across the board, but when you start getting level 2s and level 1s, that's when you start to get worried. Then we have outcome. Outcome is basically the solution of the case. In this case, outcome is shaded in. So all the areas that are shaded in are considered to be your outcome. This is relevant to the patient problem, which was testosterone in this case. So how they use it, the history of using it, why they shouldn't use it, and what needs to be done moving forward. That is out of 10 points. And if she got 8 to 10, it would be a level 4. Anything lower will be 3, 2, or 1. And then comes the fun stuff, which is communication. With communication, this is the judgment of the assessor. How well are you speaking? Are you showing appropriate body language, verbal, nonverbal cues? Are you maintaining eye contact? Are you showing empathy? A lot of times, a lot of students get confused between empathy and sympathy. We tend to say, I'm sorry to hear that, which is sympathy. That is not what PBC expects. PBC expects empathy, which is understanding person's feelings. So rather than saying, I'm sorry to hear that, it would be, I can see this must be very difficult for you. These are the skills that you learn through our course when it comes to communication. I mentioned that nonverbal communication is also graded. So your eye contact. Are you shaking your legs when you're sitting on the chair? Are you slouched over when you're talking to the actor? All this is considered. Your verbal communication. How clear is your grammar? Are you loud enough? Is your tone too soft? Are you changing your tone throughout the interaction, or are you keeping it monotonous, which is monotone? Then from there, you'll see that there's also other competencies that you get a grade on. For patient care, knowledge and research, how well did you use the reference? Communication and education, did you sound confident? Was your volume too low or too high? Collaboration, did you refer to the doctor? Did you update the profile? Product distribution, so did you dispense the syringes or not? And then finally, health promotion, which is spreading the education. So the assessment sheet is quite detailed and it may seem overwhelming at first. But our goal is that you are exposed to so many cases, over 250 cases throughout this course, that regardless of what case PBC ever throws at you, you are ready to take it. Whether you've seen something similar before or not, you are understanding the process on how to tackle these cases. Now, very quickly, before we talk about course details, I'm just going to quickly go through questions that you may have. So I see your questions, Sanaz. So some of us are MCQ students for the November exam. We want to start preparing after MCQ for Feb. OSCE regarding to group chat, is it expected to review material once before? So Sanaz, if you can verify what you mean by your question, not very clear. You are a student, so you can send me a message directly, but generally we do have different batches for students who are writing the exam in February or May. If you're writing in February, we actually have two different options, which we're going to talk about later today. Some options start after the MCQ exam for those who are writing it, and some will happen before if you're not writing the MCQ exam. I'll break down the schedule in a bit more detail. But before I do that, I'm just going to hand it over to this is quickly to explain the books that we have in our course. So in our course, through enrollment, you get access to a lot of things. First off, you get access to 6 books plus a handbook. These 6 books are developed by our faculty and have been refined every single season and updated every single season. And that means it is updated at least 2 to 3 times every year. Our first book is going to be our orientation book plus our interactive cases book. So this book goes through the different types of interactive cases you can expect on the exam. It will also show you videos of faculty performing the cases, so you kind of have a baseline on how each case should be performed. And furthermore, it goes through the orientation of the entire OSCE course. So you have a baseline, a foundation, and you get access to these books from day one. The best thing is we give you a good study schedule. So rather than overwhelming you with all these books all at once, we release them, but we have a schedule that you should follow, which will break things apart and allow you to take things step by step. So you're not expected to read everything on day one. Book number 2 goes through non-interactive cases plus practice. So I mentioned there are many different types of non-interactive cases. You will get a chance to be exposed to each and every single type, as well as possible cases which have not been tested yet, but potentially can come on the exam. And you get tons of practice throughout the course, through classes, as well as your books. Book number 3 is our minor element, also known as CTMA book. This is pretty much all of the CTMA topics you can think about in the CPS summarized for you with algorithms, so you are able to go through and understand each topic and know how to provide the appropriate recommendation. Usually CTMA cases are considered to be the hardest type of cases on the exam, which is why we spend so much time from day one and training students on how to prepare for these cases. Why? Because sometimes on the exam, you might get a CTMA case with or without a reference. Now, if you have the reference, of course, using the skills that you develop, you'll be able to do the case. But if you don't have a reference, this is where your clinical knowledge does come into play for CTMA particularly. All other cases, you usually do have a reference if there is a clinical recommendation involved. CTMA is one of those exceptions because a pharmacist is considered to be a pro when it comes to over-the-counter recommendations. So this book goes through all the algorithms, the over-the-counter products, the self-care tips, the monitoring parameters, the red flags, everything in a nice organized fashion, which you will study on a week-to-week basis until you are done the entire book, and we will practice all these cases in our class. Book number 4 will be general knowledge. So a lot of information is found in this book. This includes side effect management, what to do and how to respond to certain patients when they ask you specific questions. A lot of information can be found in this book, which you are going to utilize throughout your time with us. Book number 5 is reference checking, particularly RX vigilance. Why we're spending a little bit more time on RX vigilance now is because PBC is notorious for using a lot of RX vigilance references over the last couple of years. We've been teaching RX vigilance way before that. So all of our students were well equipped when they saw it on the exam. So that means we expose you to references, a wide variety of references, which are not even tested yet, because we can expect PBC to test you on these references in the future. So we always want to make sure you are ready before it comes to you. Book number 6 is counseling. So we have DOSAM. We're going to explain that in our course. Basically, when you are counseling, we have an acronym called DOSAM, which you utilize to provide counseling to the patient regarding prescription and over-the-counter medications. Ideally, you should be able to do counseling within 45 to 60 seconds. Seems like it's a very short amount of time, but the more you do it, the more you understand that it is not that bad, but it only comes with practice. You are not going to be able to do it unless you practice and spend the time doing it. I see that there's some questions about how much time we need to spend on OSCEs to be successful, and we are going to go through that later on today as well. And finally, we have our acronym book. This is purely as a guide for all types of cases. By the end of the course, you will know this acronym book inside out, and you will be able to handle any course or any case, that gets thrown your way on the exam. We have different types of courses available for students when it comes to OSCE, or different timelines. And that's more so because PBC did introduce a February exam in 2026. Historically, they've only ever done 2 times a year, which was May and November. But in 2026, they also added a Feb course. Now, this is definitely tricky for those individuals who are writing their exam in coming November for their MCQ. So that means right after the MCQ exam is done, you will start studying for the February exam should you wish to write it in February. Or if you want, you can always write it in May as well. But we do have a February course. This is our schedule for online, or on-site, which is an in-person at our physical location in Mississauga. So we do have a physical location there, which you can register for on-site classes. For this particular Feb course, on-site classes will happen on Sundays from 9 a.m. to 4 p.m. and will happen for 9 weeks. You'll notice that there is a 2-week break, and that break is because there is an MCQ exam happening during the November season. And that's for students, if they are taking that exam, they have a little bit of time to focus on that and then come back to OSCEs later. We also have online version of this, which is going to happen Mondays, Tuesdays, Wednesdays, and Saturdays. Same idea, you have 9 classes, but everything happens online, and we have a variety of times, morning class as well as an evening class. Now, for those of you writing the November MCQ exam, you might be stressed out because you might be asking yourself, how can I start studying for OSCEs if I'm not even done MCQ yet? For those particular individuals, we have option 2. Option 2 means you will start the course after your MCQ exam is done. So these classes will start after MCQ is done in mid-November. And you will have, again, 9 classes, but in the last 3 weeks, you will have 2 classes. So you'll notice in December 3rd, we have a Wednesday class, and December 5th, we have a Friday class. And then 10th, 12th, 17th, 19th. So for the last few weeks, it does become a little bit more intensive, but this way you are able to finish the full course by mid-December. That way you get enough time to study and practice and get ready for our mock exams, which you do get included with the course. You get 1 mock exam with your enrollment, meaning you could choose to do on-site or online. So you would physically come into our site and we would do a mock exam simulating the real PBC exam. That means you are going to be interacting in 11 stations, 9 interactive, plus 2 non-interactive. And then you're going to get a bonus session of 15 non-interactive stations, which we do as a side bonus. But in each station, there will be a different actor and a different assessor, giving you the exact feeling of the real exam. On top of that, you will get both written and verbal feedback for each station from the given assessor. And like I mentioned, you get 1 free mock exam with each enrollment, and then obviously you can decide to add on more mock exams should you want to. Now I see some questions here. Hadil's asking, do you get one-on-one practice with the tutors? How many times? So Hadil, our class sizes are very small. Hye-Yeong's going to talk about those in a moment. They're about 10 to 11 students, meaning all the classes, you kind of do get that one-to-one with the assessor. However, if you're looking for a particular one-to-one where it's literally just you and the assessor, then you can always book those as an additional add-on. We do offer that, but it is a separate package. With the class, it is a very small class, so you do get that individualized feedback. So Sanaz, I see that you say, what if you want to take on-site, but you have MCQ in November? Unfortunately, we're only able to cater that option that we have right now. So if you do prefer on-site, you can decide to join the on-site course, but come on-site after the exam is done. There will be a little bit to catch up on, but it is very doable. So D is asking, is it good to finish the course 2 months before the actual exam? Why not? This gives you ample time to study for the exam, plus you have mock exams which happen throughout January. So by the time you are done your mock exams, you technically only have 1 month remaining before the real exam. Sanaz, yes, the first session is always online. The first 3 sessions for on-site, yes. So for on-site, the first 3 sessions are online, and that is particularly because mock exams for the other students are happening during that time. The course has a variety of prices. There's 2 different types. If you choose to enroll online course will be $17.99 plus applicable taxes. On-site will be $19.99 plus applicable taxes. But we're not done there yet. There's still a lot more information to give you guys before we open the Q&A. For those of you who are interested in the May exam, we have separate schedule for that, which can be found on our website as well. We have more courses or more sessions available for the May exam because it is considered to be a full session. So you have your 3 on-site days, Sunday, Friday, Saturday, and these classes will start late Jan, early Feb. And then same thing with online, it happens pretty much every single day of the week. Usually our May and November cohorts are much larger. The reason this time the February cohort is much smaller because PBC decided to bring it up, and usually they do not do a February course. And not many courses actually offer a February session. So we're probably one of the few that only offer the February exam session, and that is why we have it. It is a condensed version. Sorry, it is the full version, but the option 2 maybe feel condensed because it's happening faster. So you have a smaller amount of time to finish all the course content that we have. And again, with the May course, you also get a full selection of mock exams, one included with your enrollment, as well as the option to enroll in many more. Now we're going to talk particularly about the courses and how we can offer specific feedback and specific things. This is going to be done by Hye-Yeong. So Hye-Yeong, go ahead.
Yes, so we're going to talk about what makes us different than other courses, what makes our course special. So we provide all the cases, including the scripts, so you can use the scripts to practice among your practice partners, and the assessment sheet for you to practice. So you'll be exposed to more than 250 practical cases, more than 200 of brainstorming cases, and more than 60 non-interactive cases. And as Parmeet earlier briefly mentioned, our class size is pretty small. It's around 10 to 12, around that number, which gives you ample time to directly interact with the instructor or tutor of that day. And you'll have in-depth discussion about every single case, and you'll get plenty of time to ask a question and get personalized feedback. Now, going into the personalized feedback, every single person in each class will get to perform on the spot, and you'll be receiving verbal and written feedback. And on the right side of the screen is the example of the written feedback that you'll be getting from the class. You'll be getting a feedback that includes what you did right and what you might have missed, and what you could have done differently, and what you need to focus now on to close any gap if there is any. The in-depth analysis of case and underlying concept for each case during the class will be provided. And of course, you'll get post-class recordings, so you can always revisit the material and the concept that we discussed in the class at any time that is convenient for you. Next slide, Parmeet, please. Thank you. And on top, you'll be getting weekly progress check. You'll be getting a study planner that literally tells you, and we will go through in class one by one what each section means and what's the expectation to get them done, for you to track your progress and upload on your personal personal website or Google Drive, based on the format they will be using that time, that only you and your instructor will have access to. So you can use that as a communication portal to submit any issues that you might have with your OSCE prep, or if you need any guidance in your OSCE prep, you'll be able to communicate directly. And on top, we do have WhatsApp groups. And the WhatsApp group, Parmeet, next slide, please. Thank you. Oh, sorry, we haven't reached there. So we'll get back to WhatsApp group in just a bit. Yes, so we do have a WhatsApp group and we do give individual performance review. Now, the unlimited support you'll be getting at a WhatsApp group, you can submit your question anytime. And our faculty responds within 24 hours. But we added the screenshot just to show you. Yes, we say that we expect the response time within 24 hours, but you probably have noticed from the screenshot that it's a few minutes, or 2 hours, a few minutes. It can be a lot shorter than 24 hours, and we are always there 24/7 to support you if you have any questions in your OSCE prep. Now, going back a slide, I do want to also mention that we provide individual performance feedback report mid-course. So you know exactly what you are good at and what you can work on, what are the opportunities that you need to work on to make sure that you succeed in this exam. And we do have one final mock exam included in your course, and you can always purchase more if you like. And in the mock exam, you'll be getting verbal and written feedback for each case. And when your course is done, that's not the end of the course. When your course is done and you have time left until the exam, we give you a detailed study plan to what to do every single week to set yourself up for success for the date of the exam. Now, I'll hand it back to Parmeet for any question and answer session.
Yeah, so I see that a lot of you guys do have questions, and we do get a lot of questions quite frequently. So we actually prepared a FAQ for everyone that may be wondering this, and then I'll open the floor once more to answer any questions you may have additionally. So some people may ask, they may be waiting for their MCQ result, which is going to come out on December 18th for those of you writing the November exam. I know the November exam is not done yet, but your results will be out December 18th. Usually during that time when results come out, our OSCE course does fill up probably within a day or two. So if you are ever worried about securing a spot, you can always do a pre-deposit of $200 via e-transfer, or you can reach out to us and we can send you a payment link if you want to pay by credit card. And you have two options. Either you continue to go ahead with our course and you can pay the balance after you succeeded the MCQ, or if things don't go the way that you're expecting or you decide to withdraw, we can offer you a full refund. And whenever you offer it, we'll give you the refund within a week. So there's no obligation. That $200 is fully refundable, but it does secure a spot. And if you like, you can always defer it to May or even November 2026 to secure a spot in one of those sessions. So that is one option that students may have if you are not sure what to do. Now, another question I get is, how much time do you need before the exam to study? This obviously depends on your commitment, and it also depends on whether you are writing the MCQ or just the OSCE, or if you're writing both of them together. Generally speaking, 3 to 3.5 months is more than enough time to study for OSCEs. However, it does require about 25 to 30 hours per week. If you break it into separate sessions, it's not that bad. You're looking at maybe 5 hours a day if you do 5 days a week, which is not bad at all. You can do a few hours in the morning, a few hours in the evening. However, things do become tricky if you decide to take both MCQ and OSCEs together. Generally speaking, MCQ is there to test your clinical knowledge and how well you memorized certain things. OSCEs is there to see if you can utilize that knowledge in a practical setting, utilizing the tools they provide you, and perform and you get assessed on communication and your performance. MCQ usually requires about 30 to 35 hours per week. OSCE requires 25 to 30 hours a week. So if you combine them together, you're looking at about 60 hours per week if you want to study for both MCQ and OSCE. Maria, you can sit for both of them together if it is your first time writing them or one of them. So technically you are allowed to write them together. We've had many students write them together, and many students have succeeded both of them. However, as I mentioned before, it is challenging and you do require a lot of time commitment. So if you're someone who has a lot of family commitments, friends, or if you have work and you work a lot, then it might be tough for you to write both exams at the same time. That is just the harsh reality of things. However, it is still very possible. You just have to make sure you spend time. So again, to repeat myself, OSCE requires 25 to 30 hours, MCQ requires 30 to 35. So MCQ will always require a little bit more because it's more intensive in memorization. For OSCEs, you're not really memorizing anything. You are understanding and practicing cases. For MCQ, it is pure memorization. So that is the difference between the two. And both exams are graded in a comparative manner. It's not like the evaluating exam where you get over a certain percentage and you will pass. With MCQ and OSCEs, they compare your score with everyone else. You have to be better than the average for you to pass that season. So everyone writing the exam in February will be compared to everyone across the country in February. If you write it in May, you will be compared with the May cohort. So your goal is always to be better than everyone else. That is how you are considered to be passing in OSCEs. There is a deadline for the Feb exam course. Usually it is well before the course starts because classes do fill up. Right now there is availability. We have availability most probably up until end of October, early November. That's when the next cohort will start. So usually by that time classes are full. Do you need extra material to study OSCEs? Do you need access to the CPS or other subscriptions? The answer is no. We literally provide you everything, including our CTMA book, which is a summarized version of the CTMA, which is easy to study. So technically speaking, you do not need anything beyond the SolRx course to be successful with OSCEs. Another question I get is material. Do we have to print our material? It depends on how you work. Majority of the time, we do recommend printing our books and printing your references. And that is more so because currently all stations on the PEBC exam have been physical references. On their website, they did state that it can be a handheld device, meaning it could be a digital reference, but up until now, they've never done that. So we always recommend students to print all reference material and material when they are studying, should you choose to go ahead with our course. Another question I usually get is, can I defer my exam or can I defer my enrollment? Once classes start, you will not be able to defer your enrollment. However, the mock exam can be referred or deferred. What I mean by that is if you started the course and a couple of weeks down the line, you feel like you're not going to be prepared for the exam, unfortunately, we are not able to postpone your seat, but we are able to postpone your mock exam, allowing you to write the mock exam the following season. And then we always get asked about refunds. If you are doing a pre-deposit of $200, it is fully refundable. But if you've done your full payment, where you've paid for the full course and you've got access to all the materials, at that point, the course is considered to be non-refundable because all materials have been released to you. So that is one thing to keep in mind. So now I will open up the floor to any questions that you may have. So I'm going to start going through them. So Qatar, I see you're asking if we do the Feb 2026 MCQ, then results will be released till the available application deadline of OSCE May 2026. It is a tricky question. It really depends on PEBC on when they decide to allow registration and close registration for the following cohort. You have to be very careful with that. So honestly, that kind of question, you will have to contact PEBC when it comes to registration deadlines for the exam itself. So unfortunately, I won't be able to provide too much insight in that. For Adatutu, I see that you asked a question about mock exams. So mock exams are completely your choice. Whether you want to do it online or on-site, it is completely up to you. It doesn't matter whether you enrolled in the online or the on-site course. For example, if you decide to take our online course, you are entitled to an on-site or online mock exam and vice versa. So mock exams are completely your choice. If you want to do online, you can. If you want to do on-site, which we usually recommend, you can also do that as well. Yeah, so with SolRx, we do pride ourselves in the fact that we start from the bottom. So as Tejinder says, sometimes it does feel like baby feeding or step by step. We do that for a purpose, and that is mostly to make sure students understand everything from the foundation up. And we work our best to make sure that you are able to handle any course, which, to be honest, has done amazing things for our students. We're proud to say that more than 7,000 students have been licensed through SolRx, and that's through OSCEs alone. If you start including MCQ, and the numbers just go up. So we have a proven track record for OSCEs, and that is something that we pride ourselves in every single season. So Fatima, how many mock tests do you usually recommend? Usually I recommend 2. I know the course comes with 1. The reason I recommend 2, I recommend 1 in the beginning of the mock season, and I recommend another one later on. Now that obviously depends on how well you do on your mock, your first one. If you find that after your first mock exam, you're still a bit nervous or you still have a few places that you want to brush up, it is a great opportunity for you to test the waters. And then you would do a second mock to further improve yourself. So usually my recommendation is 1 to 2 mocks in addition to what you already get. But again, that is completely up to the students. I always recommend writing a mock in the beginning of this mock season, and then you can choose to register for another one if you feel like it's necessary. Hadil, to pass MCQ, do you need to pass each competency or not? So you don't need to pass every single competency for both MCQ or OSCEs. You have to pass majority of them, obviously, and do better than the average. So you're not expected to beat everyone in every single competency. I've seen many students where they do amazing on all competencies, but for health promotion, they didn't do so well, but they still passed the exam. But if you start failing multiple competencies, then obviously it becomes a problem. So if someone doesn't pass MCQ in November, can we still give OSCEs in February? So technically you are allowed to do it as long as you enroll for the OSCE in Feb. The reason some people decide to defer it is because they do want to pass MCQ first, but that again is all completely up to you. When it comes to specific recommendations or requirements, again, you'll have to reach out to PBC if they do allow it. Usually if it's the first time, they do allow it, but when it comes to multiple failed attempts, you may have to write one before the other. Any other questions? I know for some of you, it might be too early to start thinking about it, especially if you're planning on writing the May exam, but now is a good time to get started. If you are unsure of what to do, feel free to reach out. You have our numbers on WhatsApp. Majority of you are in our PBC general group. You can always reach out and we can discuss further if you think of a question later on. For example, tomorrow morning, you think of something, just send a message at us so we know that we can respond to you right away. Can one do OSCE in May after MCQ in February? So Amarachi, there's no clear requirement or expectation for PBC's website. I don't see why not. As long as you do register for it before the deadline, there should be no problem. When it comes to canceling or postponing your actual exams, you will always have to reach out to PBC to get more information. You're welcome, Qatar. I'm hoping everyone did get some substance from today's session. I know it's early on in the season to start planning, but it definitely does hopefully bring some knowledge and perspective in your mind. Oh, so in terms of preparation, can you do OSCE in May after MCQ in Feb? Definitely you can, but it is going to be a short amount of time. Usually we do recommend at least 3 months of studying. So if you do finish the MCQ in Feb, which is going to happen during the end of the exam, or end of the month, sorry, you only technically got about 3 months in total. Usually, they haven't released the date yet. Usually the MCQ in May happens at the end of the season. Or end of the month, sorry. So usually it happens at the last few days of May. That's what the pattern has been for the last couple of years, but they haven't released the exact date on PBC's website. Yes, I checked a couple of days ago. So if you get 3 months, it's more than enough. I won't forget to share the recording. I know some of us joined a bit late today. We have other things going on, which is absolutely fine. I will be sharing the recording to everyone who joined today's session and registered for it. And I will also be posting it on our social medias. So please follow us on Instagram, YouTube, Facebook. We post all our content in terms of these preview sessions on our social media, so you can always follow along. We write amazing blog posts with some insightful tips. And on Instagram, I love to post videos on general communication tips. So please go ahead and go through and look at it if you have further inquiries. Any questions before we wrap up? It is 9:09, so we kind of went over, but that's absolutely fine. All right, so thank you everyone for taking the time out of your schedule and joining us for tonight's session. Like I said, if you have any questions, feel free to email us or message us, and we'll be more than happy to help. Good night, everyone, and thank you for coming.
Thank you, everyone.